Medical doctor turned entrepreneur, Dr. Mathobela Matjekane is the woman behind the Cape Town-based CliniMed healthcare facility. It has taken her 11 years to build her private practice, whilst juggling between being a wife and a mother of two. Her clinic offers primary healthcare, amongst other services, and over the years has expanded to 3 practices, operating in Khayelitsha, Mitchell's Plain, and Parklands. Welcome to the show.
Thank you so much.
You have just done such extraordinary work, but let's go right to the beginning. When you were a little girl, you grew up in Limpopo, I think.
Yes, I did.
What was your pull, I suppose, to becoming a doctor? Because I don't believe that you choose to become a doctor. I think it chooses you. But when did you realize that you had that gift?
Look, I think when I was in matric, where we used to do applications via hand and send the applications, and everybody was excited about what they wanted to do. I had a feeling in me that I wanted to do something that will empower the community and help the community.
Yeah.
And I think from there and there, my first choice was medicine at UCT, and I was lucky they took me there.
You know how a lot of kids get to go with their parents to work and kind of get an idea of business and work ethics through their parents. Your mom was a nurse. Did you ever go to the hospitals with her and then, see what she was up to?
You see, I think when I was still a baby, yes, I was aware that she was a nurse, but I was not really exposed to the nursing life that she lived. All I knew was that she worked long hours and came back while I'm sleeping, and that didn't even deter me from wanting to be a doctor.
Yeah.
So I think after becoming a nurse, she then went into entrepreneurship and was running her own factory. I think that as well, that's what stimulated me into running my own businesses and all that.
So tell us a bit about your medical student years. What did you study? What did you specialize in, I suppose?
Okay, I basically did MBCHB, which is just a bachelor in medicine and surgery. It's basically an undergrad, so when we qualify, you become a general practitioner. I then decided I didn't want to super specialize in one field. I would remain a general practitioner and just add on other things that I had interest in, like HIV and AIDS, whereby I did a diploma in HIV and AIDS management. And then I later discovered an interest in what is called aesthetic medicine, which is what I've recently done a course in.
Amazing. And of course, you worked for a very long time in the public healthcare system. I mean, what is it like for a doctor in the public healthcare system? Because we hear all about it in the news, about how hard it is for doctors and sometimes patients alike. But what was it like for you, that experience?
It was interesting, but hard.
Yeah.
Interesting in the sense that you finally get to become what you've been studying to be.
Yeah.
And when you're doing your internship and your community service, you get exposed to real sicknesses whereby you daily are interacting with patients, dealing with real death and life issues.
Yeah.
So it's very, very interesting, but at the same time, you have to adjust to the different lifestyle that you're going to be living, whereby you're working shifts and you're working during holidays, and which is something that most people are not used to, especially who are not working in normal corporate world. So it's quite a shocker in that way.
I think your work there is so labor intensive, but then you decided to add on entrepreneurship just to give yourself even more work. Why did you decide to open up your own clinic?
I think having worked in the public sector and realized there are many things that were missing, I thought, let me rather do something that is private, whereby I can do my own thing and at the same time leverage on the issue of public primary health care, which is mainly a very basic need that each and every individual requires. So with that created a platform for me to strengthen my entrepreneurship journey as well.
So tell me a little bit about your clinic. So you've got 3 in 3 different communities. What services are on offer in them?
So in our township clinics, we mainly offer your what is called primary health care. That would entail your normal colds and flus, HIV and AIDS test and management of that, baby clinics, as well as chronic management disorders.
Yeah.
And we have in our other clinic whereby we are also doing what is called aesthetic, whereby we do non-surgical facelifts as well as IV drips and yeah, anything to keep you young and vibey and
I love
fresh.
that you were doing that, because obviously I love aesthetics, and I'm definitely coming to you for a non-surgical facelift, please. But what I loved is, normally when you see, poorer communities, you don't see a focus or a need for aesthetics. So why did you think that was going to work in those areas?
Look, I think the most important thing is that we all have something in us that we would want to do something about, and
Definitely.
the impact that I have seen when somebody gets a clearer skin from having had pigmentation, the confidence they have, and the just that on its own just made me think, you know what, let me just also offer this kind of a service in this kind of
It's the most amazing, amazing thing ever. You do such incredible work.
Thank
I want to
you.
know about some of the stories on some of the patients that you've had.
Okay, just to mention one, her name is Namtla. She can never stop talking about the transformation that we've given her. It's not everybody that can afford to wear makeup every day.
Yeah.
And she wrote and said, look, for the first time, I felt very free and happy to walk on the street and not being ashamed of my face. And the fact that it's lifted her confidence. And, and we don't know the amount of self-doubt having pigmentation or even pimples on your face can do to one's self-esteem as well as their self-confidence.
No, I think people take it for granted that what it is, just for your face to be your shop front, I suppose, is so important. You are doing such extraordinary work. I mean, you're a wife, you've got 2 children, and now own 3 clinics. Really, you are extraordinary. Thank you for being exactly the kind of woman that Afternoon Express absolutely salutes. That is absolutely extraordinary. Thank you so much. And of course, South Africa wants to know some questions. Do we have anything on social media today, Pali?
So social media, I'm still gathering all the comments, so definitely keep them coming. What are you doing to lower your carbon footprint and recycle plastic use? What are you doing in your communities to make a difference? Remember to use Afternoon Express in all of your comments so that we can find you. So we continue the chat with our amazing guests after the break.